Hello, everyone, and welcome back to Entheon's YouTube channel. Today, we're going to be diving into what the company does. But first off, we're once again here with Tim, who in the previous video dove into his background and how he got into this space in the first place. I really suggest giving that a watch. But how are you doing, Tim?
I'm doing great. Busy as always, but busy is good.
Busy is good. And with nothing, there's not much else to do right now during COVID, so you might as well put the nose to the grindstone, right?
That's right. Yeah, make use of all the time that we got.
Perfect. So yeah, like I said, today we want to dive deeper into Entheon and really break it down for the common person, like what you're doing and what your mission is. And so you're working in the biomedical sector with DMT to help with addiction. Can you dive into that a bit more?
Yeah, absolutely. We are researching utilizations of DMT. DMT is dimethyltryptamine. Some people may recognize that if they listen to Joe Rogan or no names like Dennis McKenna or Terrence McKenna. Dimethyltryptamine is essentially the active psychoactive component in another pretty well-known type of psychoactive known as ayahuasca. So ayahuasca is a pretty over the course of the last couple of decades, it's been sort of anecdotally and culturally utilized for people to break through some existential barriers that they have, whether that's a sense of aimlessness or senses of shame or just a lack of direction. Ayahuasca, people travel to the Amazon to partake in sort of shamanic exercises to really dive into who they are and dismantle some of the barriers that they have and come to some new enlightenment about what motivates them and sort of what encourages them to go on. And so us as a sort of biomedical company, we understand that that process isn't the most accessible thing for people that need help. We have a strong indication that DMT is helpful to people that are struggling with some of these complex internal psychological and emotional issues, but to suggest that people go to the Amazon is something that probably just won't pass muster. And so what we're doing is we're taking that massively powerful molecule known as DMT in a very pure synthetic form so that it's both repeatable and precise, and entering that into a clinical trials framework so that we can produce that clinical data about safety, toxicology, efficacy, and do it in such a form factor that when we present it to the regulators, they are forced to look at that objectively and say, yes, it meets all the criteria of being safe and effective in helping people struggle with substance disorder issues. And so we have a clinical trial planned for Q4 of this year using 99.7% pure DMT. And then, we will subsequently do more clinical trials, but also submit to regulators and begin those dialogues so that we can start really pointedly work towards getting a approved drug product available for people that suffer.
Good. And as you had said about the Amazon, you can't just recommend everyone go to the Amazon to go on an ayahuasca spiritual journey. This is a much safer route, and it'll open the door to this molecule for a lot more people.
Yeah, absolutely. Access is such an important issue, right? Like the people that suffer from substance use disorders are sometimes the most sort of means limited people. And so to suggest jumping on a jetliner to go to the Amazon and pay thousands of dollars, we see that as being a really sort of rate limiting factor. And also from the perspective of, from cultural appropriateness, not everyone will find that the specific traditions and cultures of the Amazonian practices fit the sort of spiritual guidelines that they're maybe conditioned to or have come up in. And so really, we do want to provide a sort of a culturally agnostic approach to ultimately the delivery of a very powerful medicine. And to do so, we need to enter that into that regulatory context so that physicians that are ultimately going to be prescribing this have that basis of data that they could reference, and then individuals that are seeking to receive this type of treatment have all the assurance and certainty that yes, before I embark on this, the adequate testing has been done.
Okay. So do you guys have any real competitors in this space?
I think as we're all aware, the psychedelic industry has undergone a bit of a shroom boom. It's a very convenient, but maybe minimizing terminology. But there are, I think there's so much potential within the world of psychedelics that suddenly we have so many people entering the sphere with the hopes of legitimizing this. And so, we have, companies like MindMed, Field Trip, and all number of others that are starting to try to position around this. And a lot of the focus is on psilocybin and ketamine. And they're all molecules that are really potentially therapeutic. But part of the reason why we decided to utilize DMT is because we believe DMT, of course, captures some of those very powerful psychedelic effects, but because it is so short acting, DMT has an active half-life from anywhere from between 13 or 15 to about 30 minutes. If you can properly harness that, you can create very powerful but ultimately shorter and more customizable and controllable psychedelic experiences in a way that you can't do with some of the longer form psychedelics. So there are companies that are focusing on psilocybin and LSD for the purpose of treating these very important core issues. But some of the limitations with those long form psychedelics is that, from a physician throughput perspective, because the experience is anywhere from 4 to 8 hours, it really does limit the number of people that you can help. And during that time of 4 to 8 hours, if a negative adverse reaction does happen, because these are such powerful experiences, if a person says, whoa, I'm simply not prepared for this, and this is becoming actually quite, potentially traumatic to me, there are no real reliable measures to institute that will stop that person's experience. And so you can go into a therapeutic experience hoping for a positive outcome, but in not having the appropriate measures to control that experience creates something that is ultimately a bit damaging. So DMT, administered the way that we're seeking to administer it intravenously, if a person says, hold the phone here, I'm just not ready for this, we can return them to a functional baseline in about 15 to 20 minutes, which, provides that element of safety and controllability and really reduces potentially physician liability in terms of, long-term negative reactions.
Yeah, about to say 15 minutes feeling uncomfortable versus 8 to 12 hours with, like, say, LSD is a big difference there. So then, you guys got this model going. What is the path to take this and turn it into a functioning, profitable business?
Yeah, absolutely. So on the heels of this regulatory approval process, ultimately, we're seeing a network of clinics that are beginning to emerge. We have the Numinuses and the Field Trips of the world, and in Canada, we have other clinics like ATMA, and not to mention a bunch of other private clinics that are as of yet not in the limelight. And a lot of those clinics are operating from the perspective of working with molecules that are currently legal and available, like ketamine. But whether implicitly or explicitly, a lot of the aims of those clinics are to, provide that clinical network so that when new molecules like psilocybin, MDMA, and presumably ours come online, they're able to, deliver that to patients with a variety of psychiatric needs. And so our intention is to take this drug product through approvals, and then, we are encapsulating the approved drug product within a drug delivery technology. And ultimately, we're seeking to sell or lease this drug delivery technology to this ever expanding network of clinics, and on a continuous basis, continue to sell in the drug material that goes into the drug delivery technology. So that's a core feature of our business. But in the meantime, we do understand that there is this, sort of ballooning psychedelic market that's taking place. But right now, there are some uncertainties as to how best to dictate a course of care for someone that is suffering from something like depression or addiction. And so we've recently acquired a company in the genetic space, that from our perspective will be a very sort of near-term revenue opportunity that will provide us with additional data that will be used for further product development, but also give physicians the tools that they need to better understand some of the risk profiles that go into administering things like ketamine or psilocybin. And so we do have a near-term sort of production pathway in front of us with that genetics test. And then additionally, we're exploring additional data exercises that will give us a real-time understanding of other patient variability in the brain imaging space. And we seek to deploy that in the nearer term also, so that physicians will have better diagnostic tools to dictate a course of care for their patients.
Wow, Timothy, that was a mouthful. Wonderful. Thank you for enlightening everybody to what the company's getting into. Is there anything else you want to mention before we sign off on this?
No, I want to reiterate that, it is a mouthful. Sometimes communicating this new space does take a little bit of a little bit of detail, quite an excessive amount of detail, actually. And so I just encourage anyone that's interested in us to follow our, our Instagram, our Twitter, and sign up for our newsletter to be in the flow of that stream as we're always working on some really cool research and development stuff. And we'd love to have everyone's ears open so we can continuously communicate the evolution of Entheon.
Exactly. Sounds great. Sounds great. Yep. You heard them, everybody. Don't forget to like, subscribe, comment, share your thoughts, jump in the stream. Timothy, thank you so much.
Thank you.